I'm Mariela Alfonso, the founder and CEO of State of Place. I'm excited to be here with you virtually and can't wait to tell you more about our work with the City of Love. So, in the US, where we live determines how well we live. Poor neighborhoods mean poor schools, poor infrastructure, poor mobility, and poor quality of life. Never has this been more glaringly clear, at least to those not victim to these inequities, than in the post-2020 world. COVID magnified centuries-long spatial inequities within marginalized communities tied to structurally racist disinvestment in the built environment. BLM, especially in the aftermath of the murder of George Floyd, amplified these pre-existing spatial injustices. Indeed, the same vulnerable communities typically most harmed by other crises, higher rates of chronic diseases, higher exposure to environmental hazards and risks, higher crime rates, were those hardest hit by COVID. And the common thread is urban design. The same built environment divestments tied to these poor quality of life outcomes made already vulnerable populations that much more susceptible to COVID and, frankly, other natural and man-made disasters. As someone whose lived experiences were shaped by many of these spatial inequities, I've spent the last 20 years advocating for more equitable access to livable, sustainable, and thriving places and promoting spatial equity. By first quantifying how design shapes us, as you can see, the vastly divergent design of these two streets elicits very different feelings, perceptions, behaviors. And then I focus on quantifying how, in turn, these behaviors, choices, perceptions translate into economic, health, environmental, and social value or quality of life, which then translate to the tangible stats and metrics that matter to cities, like reducing collisions or getting more children to safely walk to school, or improving health outcomes and mitigating GHGs, or reducing gun violence and improving community well-being. The goal is, one, to show with evidence that the relationship between place and people and quality of life is all interconnected and is demanding of a transdisciplinary, non-siloed approach. And two, that design matters across all aspects of quality of life and is deserving of investment. And finally, three, that inequitable access to good urban design translates into disproportionate suffering, from higher rates of pedestrian and bicyclist deaths to higher rates of obesity, diabetes, cancer, and yes, COVID, to higher crime exposure, to a litany of other disproportionately suppressed outcomes. Now, this is the context within which we, and by we I mean my urban design predictive analytics software company, State of Place, began working with the city of Philadelphia last summer. The city understood that historically racist planning and land use policies had proliferated into myriad spatial injustices and disproportionately suppressed quality of life across social, economic, environmental, and health outcomes. But they were grappling with two key issues most city makers struggle with: limited budgets and resources given multiple, sometimes competing priorities, and a lack of community trust, that often translated into understandable pushback against well-intentioned plans. So let's dive into that a little bit more. City makers tend to have limited budgets and yet have a variety of goals they strive to achieve. So how do you begin to prioritize what, where, and whom to invest in? At the same time, once you've made those decisions, how do you communicate the rationale behind them? For the most part, city makers have been making design, development, and policy decisions without access to the right data that could help them understand which investments to the built environment would have the most impact on quality of life outcomes and key performance indicators. Instead, they're forced to rely on case studies, anecdotes, or outside consultants, which may not always be the most effective or cost-efficient way to meet their goals. And also, these kinds of decisions often happen inside the building, only seeking public input when the decisions have been near fully baked. So when you don't have data or evidence to defend your decision, and you haven't worked with and for communities, you're bound to get pushback, which, combined with city makers' lack of resources, makes it really difficult to achieve city goals and, more fundamentally, make people's lives better. So Philly, as with many other cities we work with, wanted to accomplish a few key goals. They wanted to quantify spatial inequities borne by underserved communities, quantify the links between divestment and urban design and quality of life, focused on COVID outcomes, chronic disease, specifically COVID comorbidities, rates of environmental hazards, crime, and equity metrics, and identify urban design changes most likely to improve quality of life outcomes within marginalized communities, with the aim of improving the cost efficiency, effectiveness, and transparency of their decisions so that they could actually affect change and create more livable, sustainable, and equitable communities. So for the pilot in Philly, we began with looking at 17 different zip codes throughout the city to quantify how inequitable and racist divestment patterns translated into multiple disparities across various aspects of quality of life using our typical process. So first, we collect data on nearly 150 what we call micro-scale features of urban design. Things like street trees, benches, sidewalks, bike lanes, curb cuts. And we do this using visual machine learning, which allows us to extract this data from digital images, and we collect this at the street block level. We then aggregate this data into a score from 0 to 100 that we call the State of Place Index, which measures how walkable, bikeable, and livable a place is. And we break this score down into performance metrics across 10 urban design dimensions like pedestrian and bike amenities, traffic safety, density, that are known empirically to impact our choice to walk, live, or play in specific places. We then visualize this graphically and spatially in our software so that Citymakers can easily identify patterns of divestment as well as assess community assets and needs objectively. Then our forecasting models tying urban design to quality of life come into play. Because we know that some aspects of urban design matter more than others depending on which goals the community most wants to achieve, our recommendation engine gives Citymakers a prioritized investment roadmap regarding which urban design changes they should most consider making to reach their specific aims. So in the case of Philly, this could mean adding more trees, parks, lighting, or bike lanes. But ultimately, the key is to co-create the mix of changes with communities by using our scenario tool to begin to test and iterate how proposed changes would impact the state of place score of their communities in real time. And our forecasting tools can then quantify how that increase to the state of place index would impact the outcomes they care about, like retail revenues or asthma, heat waves, vehicle collisions, crime, and more. So in Philadelphia, we quantified that places with a lower state of place index had disproportionately higher rates of COVID, both in terms of transmissions, hospitalizations, and deaths. Higher rates of chronic disease like asthma, higher average temperatures, they were more likely to be in the floodplain and had more crime, and they were also the most vulnerable, with higher concentrations of Black residents, lower income households, lower education levels, higher household sizes, less access to vehicles, and less likely to work from home. To translate how the built environment interventions could impact quality of life outcomes, our forecasting models quantify how increasing the state of place index helps communities. So for example, an increase of 5 points in the state of place index translates to 1 fewer COVID death. 10 points, 5 fewer folks in the hospital with COVID. And 20 points was tied to a 0.5% reduction in transmission. Now, to put it another way, if you were to compare places with below versus above average state of place indices, the differences in COVID outcomes were staggering, from 37, 41, and 83% drops in positivity, hospitalization, and fatality rates, respectively. Now, similarly, in places that were in the floodplain score 17% less on the state of place index on average than those that aren't, and it's the same story with heat. An increase of 10 points specifically within the parks and public spaces subindex reduces temperature by 0.5 degree. So meanwhile, places with a below average state of place index had 8.7 times more homicides. Now, this makes it very easy to see how design changes can matter to people's everyday lives, from thriving economies to pedestrian-friendly streets to healthy places, to safer communities, and to cleaner environments. So this data now powers the software and allows the city to work with and for their communities to prioritize those disproportionately impacted by poor urban design and to identify and prioritize interventions that will make the most of their budget by focusing on investments most likely to increase communities' quality of life. Bottom line, this data allows them to make better decisions and more readily engage the community around these decisions. And this enhanced decision-making communication process, that's the value of integrating data and evidence into city and policy making. But it also helps the city clearly delineate the ties between previously siloed goals, improving climate resiliency, bolstering public health, supporting thriving economies, reducing violence, and fostering spatial justices. These goals are all tied to the quality of the built environment, but they're frequently tackled independently, and oftentimes the strategies being implemented to attempt to achieve these outcomes do not explicitly involve the built environment. So, supporting this cross-sector collaboration is a key factor in ensuring that we help the city make more effective and cost-efficient decisions. Now, if you have any questions about this work, you can find my contact information here. Thank you so much.